When we use the word depression from a medical point of view, it often describes a neurological condition. Doctors will tell you about neurotransmitters and other hormones or metabolites in the brain and brain cells and the nervous system. And their approach in general, as you may know, is to offer medications to reorganize the way molecules flow across synapses in the brain or the way your energy is utilized in your body. Doctors will look for other causes like nutrient imbalances, like vitamin B12 deficiencies or other conditions. But for the most part, most people labeled with depression and treated by a physician conventionally are going to receive a medication or advice that way. In the past, psychiatrists in particular were also inclined to work with people through talk therapy. Psychologists today and other therapists do that as well. And that's all part of the current armamentarium from a conventional point of view. I would say, in fact, there's a place for that. When people are in abject situations like suicidal or highly dysfunctional, when people are violent, either to others or to themselves, or threatening such violence, society requires us collectively to figure out a way to get people off the edge of that cliff. At times, medications could be useful. Hospitalization, certainly engaged therapy is very important. But most people don't have such a condition. And even for those who do, there's a downside to that type of intervention. On the one hand, all those interventions, drugs in particular, in the past, things like electroshock therapy, which is, I would say, somewhat barbaric to even consider, but a way of shocking people into normalcy. While some of these are used, some of them are not. The conventional approach really is looking to really manhandle, literally, the condition and alter physiology. And again, if somebody's on the edge of a cliff, maybe that's what you do for the first couple of days in response. But the caveat, as people know then, is some of these conditions are long-term, and the long-term use of medications, sometimes the long-term talk therapies, really keep people perhaps in a state of neutral, but often numb, and often experiencing the side effects and the downsides of medication in particular. And that approach in general doesn't even deal with the root cause of what these ailments are, which is an imbalance, not just of the body, but of the body in relationship to the life of that person. Slow medicine is exactly that, is a way of appreciating that the medicine that we need is to connect the body that we care so much about, that we can identify when it goes awry through these various syndromes, but then to understand its connection and relationship to things like our relationship to the natural world, relationship to other people, relationship to our spiritual existence and what's beyond this world, the communities in which we live, the thoughts and emotions that circulate inside of us, all conditioned in part by the collective culture and our personal life experience. But there's a lot of elements coming together at the moment of the cell synapses in our nervous system, and that create symptoms. People, though, are unique. While symptoms may be common, their individual life and the way that body interrelates to those other factors is very unique. And so I believe, and slow medicine advocates, that people are treated as individuals and that they actually receive enough care for that individuality to be understood, and then for the offering of ways of balancing each and every one of those areas.